Starting now. Hello and welcome everybody. My name is Kathleen Sullivan. I work as one of the senior coaches and career coaches in the professional support unit for London and KSS. I'm absolutely delighted to be here with Dr. Saira Khalique, who is a consultant in medical oncology. Hello, Saira. Lovely to see you.
Hello, Kathleen. It's really lovely to be invited to talk with you. We met after return to work from my PhD and also during the consultant preparation courses that the deanery ran. So it's lovely to come out the other side, and happy to chat today.
Absolutely. Yeah, it's really good to see that you coming out the other side into your consultant post. So, and you're 18 months, is that
Yes,
right?
I have I'm a substantive consultant at Mount Vernon Cancer Centre, which is on the Northwest London rotation. And I started initially as a locum, but then had my permanent position start July 2022. It's all still very fresh.
Yeah, absolutely. And I think this is going to be really useful for the trainees to hear really from somebody who's relatively new, can I say, as part of the consultant team. So just a few questions. First one is thinking back to the time when you were about to become a consultant. What would you say were your hopes and fears about that?
I think number one, I wasn't sure if I was ready. And number two, would I fit in? And number three, would I get the opportunities that I had kind of dreamt about for the last decade whilst in training? So I guess the first one, thinking that I wouldn't be ready despite all the training, out of program experiences, PhD, I think I started to realize I was getting impatient doing the administrative tasks for senior colleagues and was thinking, actually, it'd be really good if I could review this trial document, present it at a meeting, and run the trial myself. I think that's when I realized I was probably close to ready. And then very much, yes, I am ready. And in terms of fitting in, I hadn't actually worked at Mount Vernon Cancer Centre. It was one of the 4 training locations on our deanery, but it just so happened I never got the opportunity because senior registrars had chosen to stay there for their training. But my good friends and colleagues had said that they thought I would. So it was a bit of a unknown for me. And I did start as a locum, and that was mainly because of the time it took for the permanent job to go through the college. But it gave me just a couple of months or so to kind of experience and try it for size. And in other ways, it's quite good to go somewhere that you've not been because you're not seen as the registrar who's just stepping up. And I think it was good to come in as a fresh person. And then would I get the opportunities that I was hoping for? I think I'd always trained in central London. So that was kind of my thought process. There'll probably be a job in central London that will come up. But actually for the subspecialties that I was looking for, there wasn't a permanent position in the cancer centres within London. And so although Mount Vernon is just kind of slightly northwest London, it turns out that I've had far more opportunities than I think I could have envisaged. And I've got a permanent position and I'm just about 40 minutes drive from home, which I think is a win that I kind of was unfounded fear really. And thinking about the hopes, would I, again, really wanted to fit in. And I was hoping to maybe start a couple of clinical trials in my first 1 to 2 years. And we could talk more
Yeah.
about in
Well, I guess, yeah, because it
yeah.
leads quite nicely because I think we wanted to also hear from you about, when you took up that consultant post, how well would you say your expectations were matched by the reality of it? Yeah.
Yeah, so I think I found that Mount Vernon to be a very friendly place. And I think most people are happy to chat about complex cases or even just issues with day-to-day, queries that you've got. And due to unforeseen circumstances, I've ended up taking on a lot more responsibility earlier than I would have anticipated in, my role as a new consultant. But what I found was, having a supportive clinical director and also talking to a mentor about things has helped. So although I've had to sit down, identify issues and come up with solutions, but I've been able to go back to people that can actually help make the change. I've had to say to myself, you've got to put your big girl pants on now. And, you might not want to do this, but you've got to sort something out. So I think through adversity can come growth. And I've definitely learnt a lot. So I've ended up taking on 5 clinical trials that I wasn't expecting to, on top of 4 of my own that I have set up and run. So far more than the 1 to 2 that I was envisaging. But I've learned from those, some of those trials are closing out, and that's normally a 3 to 5 year cycle. So I've ended up in my first, 18 months of being a consultant, learning how to set up trials, learning how to, get patients on trials, but also how to close out and how to work with wider members of the team and industry about that process. So it's been quite a formative time.
Oh, yeah, it sounds like quite a lot, definitely. So what, I guess next question is, what do you know now that you wish you had known back then when you were just embarking on your consultant career?
So I think people do listen to you. When you're a consultant, you are often the ultimate decision maker for basic things. So you will get CC'd onto emails about, can this person go on holiday, and the things that you think, oh gosh, do I really need to know about this? But other things, if you need something doing or you need to help make change, your voice is a lot stronger now than it was as a registrar. And what that means is that, if you identify things that need change, then you can actually build your team and embed that change. So I waited until I was a permanent consultant to bring in a change. So we now do a pre-clinic run through of all our patients coming to clinic. And it's the one day that one of our teams, we are all on site. That's our nurses, reg, other consultants, and our allied health professionals. And so then 6 months later, we also have a lot of patients that end up in district general hospitals. And these are complications of treatment that can often lead them to be there. But it meant that we all know what's happening with the patients, and we can all make sure that we can give the right advice. And now another 6 months later, we've got our new patients. So we're now keeping track of every new patient and all their molecular markers, because the genetic results do change what we do, and we have certain timeframes. And bit by bit, by making those changes, I can look back and say within my first couple of years, there are definite changes that are hoping to shape that practice. And I think you appreciate that not everybody works in the same way. So it's working out how you can get the best out of each person, or work with those bits, and also accept that some changes may not work and you might have to revisit how to approach your situation. I think that's probably one of the main big things. And
Yeah.
I think also we're talking about tricky cases, or finding people at different levels. So I think as a new consultant, knowing your peers who are going through the same thing, be that in your trust or in your region. As a medical oncologist, we've recently had our new consultant group meeting. So that's consultants from the first 5 years. We meet once a year nationally, and everybody goes through job plans, inquests, all of these bits that no one ever tells you about, complaints, and the day-to-day, how are you doing? How's it going? But also senior colleagues in other specialties. So I'd had a patient that I had to treat with a lasting power of attorney, and they were quite poorly, and I was a bit worried about the case, but I knew that it was the right thing to do. And I mentioned it to this consultant, and they said, actually, we get one of those every few years. It's always a bit nerve-wracking. But yeah, it sounds entirely appropriate. And that literally 1 minute, less than a minute corridor conversation made me think, okay, I'm not the only one that gets a bit nervous about these tricky situations. And that just made me feel a lot better about it. And that patient's now fine, and they're all very grateful. But it was a bit nerve-wracking the first time when I had to do that.
So yeah, I think just to wrap things up, my final question for you is really key advice. Any words of wisdom and top tips for trainees who are just about to take up their new role as a consultant?
I think being approachable makes a big difference, because often things can be sorted at a very early stage. And having a good working relationship with your secretary, your, the nurses and other health professionals that you work with. We had a really big Christmas dinner because we'd had quite a tough year, and I think that helped everybody bond and keep the morale up. And I think that's really important, especially with the way the NHS is at the moment. And I remember somebody saying to me about these 4Ds, can you deal with this? You're going to get lots of emails or people coming to ask you, can you deal with it now? Is it something that can be deferred? Is it something you can delegate? Because actually you don't always have to be doing everything. And although it might be quicker for you to do it first time, you probably need to set up a system where you're not constantly the first port of call. or do you need to do it at all? Is it something you can just dump? And then practical things like planning 6 to 8 weeks in advance, thinking, when is your next break or holiday? Or have you got a conference or meeting you want to go to? Are you doing something like research or education where you need to have that built into your calendar? As well as things like checking your pay scale. I had help from the BMA going through my contract, and I was a less than full-time trainee for a period of time. And I was on the wrong pay scale at the start, but that was quite easily adjusted. But sometimes you just needed to make sure that things are right on your contracts. And I guess finally, making peace with imperfection. And sometimes, you're doing a good job, and maybe that you just need to get through some of those challenging periods, but also making sure you build in time for yourself. So self-care, and if that's exercise, running, book clubs, that's exactly what you need, to build in, because it's
And
a
I know,
long career.
and I know, knowing you, and I do know you, and I know that those aren't just words. I mean, you do walk the talk in that respect, and really looking after yourself, and that's part of the puzzle, isn't it? To keeping everything going as smoothly as you can. I think this went quite smoothly. Thank you. Thank you so much. I really appreciate you taking the time out of your busy schedule to join us for this. And I think it would be really useful for everybody to hear your thoughts and all the advice that you've given us. So thank you so much,
Oh
Sarah.
no, it's been my pleasure, and always happy to help. Yeah.
Excellent. Thank you. Bye.
Take care.